During this video, we'll explain what's involved in an endoscopic retrograde cholangiopancreatogram, simply known as ERCP. This is a procedure to investigate and sometimes also treat problems in your liver, gallbladder, bile ducts, and pancreas. These structures all help with digestion. The liver is located in the upper right of your abdomen. It makes a substance called bile, which helps break down foods to digest them. A small organ under the liver, called the gallbladder, stores the bile until it's needed. Thin tubes called bile ducts carry the bile from your liver to your gallbladder and small intestine. The pancreas is a gland that sits behind the stomach, which also helps with digestion. It produces various digestive enzymes and chemicals which are passed into the small intestine through thin tubes called ducts. ERCP can look at all of these ducts and parts of these organs. The procedure is done using a tool called an endoscope, which is a long, thin, flexible tube with a camera, a light, and a channel to insert instruments. X-rays are taken during the procedure too. To start off, an intravenous line, or IV, is usually inserted into a vein, usually in the back of your hand. Sedation medicine is usually given through this and will travel via the bloodstream throughout your body to help you relax and feel sleepy. This is not the same as general anesthesia, but you'll feel relaxed and are unlikely to remember the procedure afterwards. You'll lie on your side on the couch. You may be given a throat spray containing local anesthesia to numb the back of your throat. You may also be given a small plastic guard to protect your teeth. The endoscope will be inserted in your mouth and guided through the esophagus, stomach, and into the first part of the small intestine, known as the duodenum. Images will be displayed on a monitor for the healthcare team to view. Video may be recorded and photos are taken. You may then be asked to change position on the couch. A small tube from the endoscope will travel into the ducts. It will release a dye to help visualize the ducts using X-rays. The healthcare team will examine the ducts carefully. They'll look for any abnormalities such as blockages, growths, or gallstones. In some cases, it may be possible during the same procedure to remove any stones by inserting instruments down the endoscope. They're likely to take some biopsies if they see anything abnormal. A biopsy is when they take a small piece of abnormal-looking tissue and send it to a laboratory to make an accurate diagnosis. When the procedure has finished, the endoscope will be removed. You'll be helped onto your back and may be given an oxygen mask. You'll be moved to the recovery area to rest while the sedation wears off. You may have a sore throat for the first few hours or days. However, this will settle with time. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.